the reason we're doing this webinar is we had many questions. We had a lot of feedback from the public asking questions about death, handling burials. Dr. Nyamongo in her speech last time questioned a lot about how we are handling this nationally. So we are very pleased to have Dr. Oduor join us to really shed light on this subject. So I'm going to let him do his presentation, and then we will have questions after that. So we can start that off. Dr. Oduor, you're welcome.
So thank you very much, Lillian, for giving me this chance of speaking to fellow Kenyans on how death's been handled in this era of COVID-19. So my presentation will just come from the guidelines which we made when this disease came, and we saw that there was need for ensuring that bodies are handled well, prevent transmission of infection from the human remains to the living. So locally, the first case was reported in Nairobi on 12 March 2020, when some lady from US through London and checked herself into hospital with the symptoms. And the cases have been rising steadily locally, initially being reported on persons who had traveled from Kenya to Kenya from various parts of the world. But now we are seeing cases of local transmission, which is now what is happening. In Kenya currently, they are reported about more than 3,000 cases so far, with a total of 92 deaths. And the aggressive interventions have been put into place by the government, including invoking Public Health Act, formulating legislations, guidelines, which touch on many areas, all of these aimed at containing the disease. One of the areas of intervention is how to handle bodies of diseased persons who die as a result of COVID-19 infection. And this led to formulation of guidelines titled Interim Guideline on Handling Human Remains Infected with COVID-19 in Kenya. This guideline was made by a team of experts from MOH, UN, Aga Khan University, JKUAT, and other partners. So first of all, we emphasize on reduction infection control practices, which lead to reduction in transmission of infection, but also taking care of dignity and religious affiliations in handling of human remains. And the guidelines also formulated, in keeping with the relevant laws in Kenya. The procedures to be followed were divided into these areas, including handling of human remains at the community and in hospitals, handling of human remains in mortuaries, disposal of human and others. So at the community level, if someone died at home, you need to notify local health officials at the nearest health delivery point, and they ensure that you follow strict standards of precaution in handling the bodies, use of PPEs, and application of hand hygiene. This body is supposed to be double body bagged, with the external body bag being disinfected by use of 0.5% sodium hypochlorite solution. Then the body bag is labeled. Someone dying in hospital, once it's confirmed by a relevant healthcare provider, the body shall immediately be tagged and placed in a leak-proof, tamper-proof body bag, also double body bagged, same as what we just talked about. Then use of PPEs and also the contamination of the area where the person was. In the mortuary, we have storage of the body, we have postmortem procedures, we have engineering environment for autopsy, we have minimally invasive procedures and cleaning of the mortuary. So when death is confirmed by relevant healthcare provider, body shall be placed and tagged to liquid type of body bags. And what we are actually advocating for is if these bodies come to the mortuary, mortuary has to have one area which is set for COVID-19. So all the bodies will be placed in the same refrigerators with aim of containing spread and allow for maximum precautions during handling. And there should be no commingling of this body with other bodies, so that they are placed in their own separate area in the mortuary. And of course, the mortuary staff use standard precautions, including proper hand hygiene and use of PPEs. The mortuary attendants must ensure that the body is handled applying with the body and the environment, and use of appropriate PPEs at all times. There should be minimum movements while handling the body, because we fear that spillage can lead to a focus or infection. And of course, once the body is labeled and body bagged, we discourage embalming of the body. The reason being that during the time you're embalming, you are also manipulating the body excessively, and with the chance of probably creating aerosols which can cause infection to the mortuary staff. When it comes to postmortem examination, even though we are discouraging postmortem, but we envisage that if we have a postmortem suit with what we call negative pressure ventilation, we'll be able to do these autopsies. So these are procedures which should be done in a designated referral institutions by adequate trained personnel and infrastructure, and ensure that stringent safety measures are put in place while performing postmortem examinations and collecting samples. A limited postmortem should be done in a designated isolated space in the mortuary. Use of a minimally invasive procedure for tissue and fluid swab sampling. Negative pressure autopsy suit, which I've talked about. Use of PPE is very important, and examination of the body while in the body bag, so that now we limit body movement and spillage. Once the limited autopsy is complete, the body is packed with cotton wool, which is infused with a 10% formalin, with a focus on punctures on the body and sealing any leaking areas with cotton wool, including usage of mussels and bandages. Then zip the bag as fast as possible, and we are still emphasizing no embalming the body. Engineering and environmental control for autopsy, safety procedures in cases of a diseased person infected with coronavirus disease should be considered. With those used for any autopsy of people who have died from any acute infectious respiratory illness. And if a person died during the infection period of the coronavirus disease, the lung and other organs may still contain the virus. In addition to, so we need respiratory protection during the procedure. Negative pressure rooms, we talked about it, must be used with control the direction of airflow when using mechanical ventilation, and adequate natural or LED lights, depending on the time of the day. Then instruments used during autopsy should be cleaned and disinfected immediately after autopsy as part of the standard routine procedure. Of course, here we talk about cleaning. Once autopsy is done, the place should be cleaned very well. And of course, ensure that the PPE is used. Items classified as clinical waste must be handled and disposed of properly and safely, according to standard infection prevention and control requirements and legal requirements, and only minimum number of staff will be involved. And we know that when you are doing some of these autopsies, we use oscillator, this create a lot of dust and the aerosols, so we discourage this. The mortuary must always be kept clean and properly ventilated. Soak surfaces with the solutions that I talked about, sodium hypochlorite. Then clean surfaces, clean all surfaces with water and detergent, and daily fumigation. Transportation of bodies must be placed in double bags and exterior surface be contaminated for transport. Of course, we are discouraging repatriation out of the country because of the guidelines. The airlines usually don't carry bodies with infectious disease. And of course, bodies should be placed into casket while in body bags. The caskets should not be reopened for viewing of the body, and the vehicle used to deliver the body will follow cleaning and fumigation guidelines. Body disposals are carried out under strictly under supervision of a public health officer or healthcare practitioners. And the disposal of human remains with COVID-19 should be overseen by a public health officer and should be done within 48 hours to avoid community practices which will result to more infections through contact. And the health worker should ensure that the casket is handled using PPEs at all time. The body must be buried on the same day of the releasing from the mortuary immediately by family under supervision of healthcare provider, the local healthcare committee leader, and religious leaders. And of course, the relatives are strictly forbidden from touching and kissing the body. The local healthcare authorities should designate a team to oversee the process of human remain disposal in case of coronavirus disease deaths. So we encourage family involvement. You know that when someone dies, still part of the family, so the family should be involved fully in the preparation, in the burial. We also declare dignity. Dignity is paramount. Sensitivity on issues including culture and religious inclinations, as long as the culture is not ones which lead to infection, spread of infections. The restriction of the number of people attending the funeral, we know that currently there is 8 to 15 people. Then for unclaimed infected bodies, the minister can invoke public health act in case for disposal. So the areas which we talked about in the guidelines of waste disposals, the standard ways of waste disposals, fumigation of place of death, mortuary data handling, transport and handling of specimen, identification of mortuary handlers, and counseling and debriefing, which are also very important. So in conclusion, this being an interim guideline, it may undergo modifications depending on the development seen as we continue to understand the disease. And I emphasize that public health prevail in handling of human remains. Thank you very much.